How well is government handling the vaccine issue, if at all? Wits University's Professor Francois says government needs to communicate a lot better, both on the coronavirus itself as well as the upcoming rollout of vaccines. He's with the Wits Reproductive Health and HIV Institute and joins us now. Professor, good afternoon to you and welcome. I want to get to the communication issue in just a moment, but highest single-day increase. You've just heard Glenda Gray saying that this is a terrible place to be. What's your assessment a day before Christmas? Do we have a grip on this?
No, and I think that this is one of the worst possible scenarios we could have seen coming. The second surge hitting at us when we actually at our weakest, both mentally, we've had a horrendous year, and then just socially, this is the holiday season. This is when we all just need a break. So no, this is not good news for the country, and I agree with Glenda. I think that I'm scared that everyone is just taking a deep breath in and just letting their guard down a bit at the time when this virus may actually be more transmissible, more scary than it's ever been before.
She's absolutely right that had we followed protocols a little better, all of us, we wouldn't find ourselves in this parlous position.
Yes, I think that's, this thing is within some realm of control for each and every one of us. Staying outdoors, trying to avoid crowds, trying to just follow all the basic protocols. But I think also, it's hard. I think we all need human contact. I think it's interesting to watch how many politicians and senior scientists have been caught out visiting their families and all the rest. And that's because we're human. I think that we also need to understand how hard what we're asking of South Africans is, which makes it even more important that government is transparent in terms of its communication, so that people can make the hard choices, understanding that it is for the greater good.
Where is your concern about a lack of communication? Where is government failing then in that transparency?
So I think it's important to separate the vaccine issue and then the other thing. I think the whole year has been characterized by a series of poor government decisions, in some cases bizarre government decisions, and then just government decisions which actually just need a little bit of explaining, which actually were rational. And instead of trying to do that, we were just given edicts, just trust us and go forward. And the problem is when government makes bad decisions which are unscientific, the tobacco ban would be a good example, decisions which were clearly political, such as the churches, allowing people to go back to church, and for the packing of the taxis in September or so. Those were political decisions, and government pretended that they were health decisions when they were clearly not. Those undermine public trust, and we need absolute public trust in government at the moment, so that government issues clear, transparent guidance to people so they can follow it, understanding that it is in their own best interest. But when government transgresses that public understanding, that trust bond, it undermines any sort of messaging. Then it becomes much easier to toss away the mask, to go to a bar, to take the masks off on an aeroplane. All those things start happening. The vaccine issue I'm critical about because government is not good at getting drugs and getting interventions cheap. If we left government to get our antiretroviral program without the help of activists, of scientists, of people shaming the international community, forcing and talking to donors, this is a massive collaboration. We would still be offering the most basic care to people with HIV. And what government's saying with vaccines is essentially, we got this, trust us. And everything we've indicated from us is that the level of detail is so tiny that it's very hard to trust government in this endeavor. It may well need us as scientists, us as activists, people who are experienced in dealing with this stuff to come forward and help them gain access to vaccines when South Africa is not at the front of the queue. That's my frustration at the moment.
Given the position that we find ourselves in right now, is there a need for us to look at stronger measures? Do we need to move to a higher level lockdown before the new year?
I hate the lockdown language because I think the stuff that we needed to be doing, we should have been doing in March this year. And I think the priority setting should have been restrict indoor congregations. All the super spreading events we've seen throughout the world have been indoors. So try and get guidance to people where you are congregating indoors. How can you do this safely as possible? Get the windows open, get the doors open, get the ventilation going as much as you can. We're blessed in South Africa with decent weather. Rather than this kragdadigheid, let's change the rules one day after the next. So I think there is room for increased intensity in certain places, but government needs to do that intelligently. And I'm not convinced that these kind of blanket statements across provinces or even within provinces is actually going to get the kind of buy-in that we need. We're in a parlous state at the moment. We certainly do need people to be taking things more seriously. But saying to people on a non-crowded beach to go and, to get off that beach doesn't make sense to me. On the other hand, walking through central Johannesburg and seeing a packed restaurant where the windows are closed because it's raining outside is probably a far greater risk to everyone involved.
Can I ask you one final question? Again, I'm not entirely sure whether this is in your remit, your area of expertise, but maybe a little bit more clarity on this new variant. Is it worse? Does it have the propensity, the potential to spread more quickly?
So it seems so. It seems to have a greater propensity to spread. And just for your viewers, you're going to have to anticipate that you're going to hear a lot of "we don't know yet" statements from scientists, and that's the right response. It does seem like it spreads much more efficiently than the previous variant. It's already been seen. The South African variant's been found in the UK. The UK variant's been found in Nigeria and in other countries already. So it does seem to spread more efficiently. And lots of viruses do this. They mutate. HIV mutates all the time. Flu mutates all the time. This thing is obviously able to do that. Whether it makes you sicker is yet to be seen. Whether the vaccines will continue to work in the face of this new variant remains to be seen. And it's very frustrating. But that data will come. And that data, sadly, is probably going to come in the next few weeks because we have so much virus circulating. It's going to be testing people who've had the virus before, the previous bout of coronavirus. It's going to be testing other things, and those people who've had vaccines in the UK and America.
I'm going to steal 30 more seconds on this interview. When you say it spreads more efficiently, I don't understand.
So it seems like it's surged in a way that we haven't seen with the first one. So despite the fact that we were in much more draconian lockdown in over June when the first surge happened, we've been much more blasé over the last little while, and it actually seems like the numbers are worse than the first time around. The same is being seen in the UK. So as I said, we need proper data, and this is subject to correction once we get enough. But the fact that it's displaced the other virus, the first round of the virus, so quickly and so efficiently does suggest that it's got a transmissibility benefit to the virus. What else that means, we don't know. It's one of the explanations for this massive surge that we're seeing at the moment across South Africa.